Flop, Kevin, flop. Flop onto me. Donate blood. Donate blood. Yoga, pat down. Cops are here. What do you think about that? Hugs. How do we feel about hugs? Today is Friday, March 18th, so we had a busy morning of appointments. We saw Lemmy, who was an Airedale Terrier who had a ruptured cruciate ligament. Ooh, that's crunchy. Gross. Oh, it's a crunchy knee. So when I flex his toes, my finger moves forward. So he's got a thrust. So this knee should stay nice and stable, but his moves in a way that it shouldn't. Oh yeah. Oh, that's pretty bad. So he does unfortunately look like he has a torn cruciate ligament. So I just brought some more information to actually show what it is, because it can be a bit difficult to see and think about. And there's little ligaments that hold that knee in place. He looks like he's torn one of his cruciate ligaments. What we can see on that x-ray would be changes that are typical of dogs who have a torn cruciate. So we look for inflammation in that joint. And what can happen over time is there can be little bony changes on the underside of some of the bones from things rubbing and moving in ways that they're not normally supposed to sit in. In an ideal world, he would go and have surgery. In a big dog, there's pretty much only one procedure that we would consider, and it's called a TPLO. What it involves is, if he were to get that surgery, going to a facility where they can perform it, and it actually involves making a cut in this bone and rotating the angle that the bone sits in. So we're trying to basically make his leg more stable and make it so that he wouldn't need that ligament in the knee long term. With that procedure, it's about an 8 to 12 week recovery period, but that will give him the best chance at long-term outcome and long-term good quality of life, because it's actually going to go ahead and address the issue.
Yeah.
The only other non-surgical options would be physiotherapy, rest, and medications to keep him comfortable. And what will basically happen over time is there'll be a lot of inflammation and scar tissue that'll form in the knee. And it's not necessarily going to fix the problem, but it would allow him to, walk and do basic functions.
Is it worth kind of trying to see how he does over the next few weeks with trying to manage it and kind of seeing how does it go, and then making a decision, or does he have to is it you have to get him surgery right away, or?
Good question. So I do encourage most people, if you're potentially able to do surgery, to try and get in at least for the consult, and you can, he'll be on pain meds between now and then. You guys can have some time to think about it. But the sooner we do it means that his joint will be in the best condition.
Right.
I can make the referral to a Calgary clinic, and hopefully they'll get you guys in sooner rather than later, and give you guys some time to think about it between now and then.
That sounds good.
And typically, we do recommend doing some blood work beforehand to make sure there's no pre-existing condition like a liver or kidney issue that might cause him to have an adverse reaction to the medication. Well, I'll borrow him and we'll do that, and then it should be just about 20 minutes, and then we can get you guys on your way. Cool.
Sure.
Okay. While in very rare cases there can be liver or kidney damage from using NSAIDs or non-steroidal anti-inflammatories, so we do recommend doing blood work before, just to make sure there's no issue pre-existing that would put him at increased risk, but it is very, very rare. So Izzy tore her nail at the dog park about 2 days ago and had been licking and licking and licking at her foot ever since. So by the time she came in to see us, there was a pretty significant skin infection. Things were pretty red and inflamed, but the nail was actually completely off. This is what's left of the toenail, this little red, but it all looks so red and angry. And then her whole paw is super infected. Yeah, because you've been licking it. I think there's a tiny little piece of the claw left. So we clipped the area, gave it a bit of a scrub. She's so strong in those quads.
She is.
She does not skip leg day. She's got the cone of shame, so she won't be able to lick it going forward. And we gave her some cream that should help to clear up the infection, and also just a bit of a steroid by mouth. So hopefully that'll bring down some of the inflammation over the next couple of days as well. And then Dr. Yolanda also saw Debbie, who was a very unhappy kitty.
I mainly just want to get her like overall health checked out.
Okay.
And then along with that, she does have some bumps on her back and on the base of her tail here.
Okay, since when? When was
I just noticed them maybe a month ago. Hi, baby. Oh, I know. She's a chatty Cathy.
Come here,
She's
Debbie.
usually very sweet. She might hiss, but she's all bark and no bite.
Okay, so you said there's 2 lumps. What else worries you?
And then the other thing is her breathing. I find she's snorting a lot, and then even just on the way here, she was making some noises that I've never really heard before.
Okay, is there any smoker at home?
No.
Do you have carpet at home?
Yes.
Okay. Because sometimes breathing, hi sweetie, heavy breathing, snoring could be allergic or secondary to an allergen at home, right?
And we took them to the vet, and they said it was nothing to worry about. It just comes up. But these ones here, this one's actually.
Can you point them out?
And this one is on the base of her tail.
Do you want to bring her there?
Yes. It's on the actual tail, and it's like they're okay. Here, I'll use it.
Oh, Debbie. Debbie's not going to cooperate today. Let's do something. I am going to take her to a treatment area.
Okay.
I'm going to get one of my technicians to wrap her in a towel with cat pheromones to see if we can get a better exam. So I will do a full exam on her and then come back and we'll chat about what we find and if it's concerning, if it's not concerning, and we'll come up with a game plan. What do you think?
Deal.
Let's do that. I'm just trying to look for the lumps that the owner mentioned. It's just a little growth there on the skin. It looks like an epithelioma, so I'm not worried. Look, it's almost like a little cyst. Do you see that?
What is her name?
Debbie.
It is Debbie.
Yeah. It is. It is, right?
The owner's name's Debbie.
No, the cat's name is Debbie. She even told us.
All right, the owner's Alex.
Yeah. I was like, oh my god, how did I make this mistake? But she's even said it's like she's like a grumpy old lady, like a middle-aged lady. I'm like, yeah, very fitting. I just need a vet to listen to her. Mel can listen to her right now. We got her.
All you have to do is go Alexa wall off.
Well, I didn't know. And I see people paying ding, 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 ding. I'm like, hello, we're dealing with Debbie from hell. Okay, Debbie. So her physical exam obviously was limited. The one lump I found on her tail, I'm not concerned about. I couldn't find the second one. She's really, really upset. So when I listened to her heart, to her chest, I actually do think she could have increased lung sound, so she could have something like bronchitis. But there's no way we can x-ray Debbie without sedation. So if you wanted to do that, we could sedate her, x-ray her, do a more thorough physical exam, and then go from there. Examining Deb was not easy today, so Based on that, we have to sedate her, have to, like, you know, if we were to do x-rays, there's no other way. Since that has to be done, the owner's not interested to do that today, so it's okay. There's nothing super concerning. If we need to investigate that snore, like, the x-rays would be helpful, but this is good for now. At least Debbie's going home with a rabies vaccine, which is good. She's good to go. Alrighty, Debbie, that was fun.